Debbie, and I'm a registered nurse, and I'm going to be performing a musculoskeletal and a neurological exam on Cody today. Hi, Cody. Before I start my exam, I want to make sure that I've performed hand hygiene and that I've provided privacy, which I have. So we're going to start by assessing your upper extremities. And I'm going to start by assessing your radial pulses and your brachial pulses. So, I'm going to assess his radial pulses, and they're strong and equal. His brachial pulses, and they are strong and equal as well. So next we're going to move on to the muscle strength in his hands. So I'm going to have you set up again for me. If you would. And I'm going to have you make let's see, for the hands. Actually, let's have you squeeze my fingers first. Okay, good. And I'm going to go ahead and have you push and then pull too on me as well. So pull towards me and push. Okay, good. So that's part of the assessment for the strength in his arms and his hands as well, because we did the grips. So as I'm doing this, I'm also assessing his upper extremities for color, and he's warm, so he's getting good blood flow. That's good as well. And next I'm going to assess, again, his strength in his arms. So I'm going to have you turn upside down, and then I'm going to push down, and you're going to resist my force. So, okay. And then I'm going to push out, and he's going to keep me from pushing out. And then I'm going to try to push in. Okay, good. All right, so he's strong there. Next we're going to go ahead and assess the shoulders. I'm going to assess the range of motion in the shoulders, so I'm going to have you stand up for me. And to assess the range of motion in the shoulders, I'm going to have you lift your arms straight out, and then that's the flexion portion, and then we're going to extend backwards on each side. And then next, you can act like you're scratching your neck there on each side with each hand, and then we will do have each, take this hand and kind of act like you're going to try to touch that other scapula. So that looks good there. Now we'll do the other side. And these are the expected findings in a healthy adult. So we still need to finish assessing the shoulders just a bit. I'm going to have you take each arm and do this with it, and that assesses the adduction portion of it, and then if you move them out, that's the abduction portion of it. Okay, let's see. Next we're going to move on to the lower extremities. So I'm going to have you lay back down, and I want to start by assessing the symmetry of his lower extremities. And when he was standing up, I was also assessing to make sure that he was standing up straight, that he wasn't leaning towards one side, that his hips looked proportional and even as he was standing. So again, we're going to assess the color in the legs. We're looking for possible varicose veins if he had any, which he doesn't. The hair is equally distributed, so that's also a good sign of good blood flow. So next, we want to assess the range of motion. So I'm going to start by assessing the range of motion in the hips. So I'm going to have you lift this leg to a 90-degree angle. That's the flexion portion. And then back down. And then I'm going to have you adduct it outward. And then abduct back in. And then the same here, 90-degree angle, flexion. Back down. And then abduct. And then adduct back in. Alright, the last part of the hip exam, we need to have you turn over on your belly. And I'm going to have him do the extension portion of each leg. So if you would just keep each leg straight and just lift it just a bit. So that's extension, and then lay it back down, and we'll try the other one. Oh, great. Okay. Now you can turn back over if you would, please. And next we're going to assess the range of motion in the knees. So I'm going to have you bring each knee kind of to your chest. All right, and before you put it back down, I'm going to have you do just rotate outward just a little bit with it, and then just slightly rotate inward as well. So we'll do that on both sides. And then just try to keep your knees straight as you can as you're doing that. I know there's not a whole lot of room. You can move them there as you're doing it. Now we're going to do the ankle portion. So I'm going to have you raise your ankle just a bit, and I'm going to have you take the bottom part of your foot and kind of tilt it inward just a little bit, and tilt it out. And that's the ankle portion. And then we'll do that on this side. Tilt inward, tilt outward. Okay, back down, and then I'm going to have you extend your toes, so kind of point them down, and then flex them back up towards your face. All right, perfect. And then I also want to assess the strength of his legs and his knees. So I'm going to start by, I'm going to have you raise your leg just a little bit, and I'm going to kind of put some force on it, and you're going to resist that force, okay? All right, good. And then I'm going to try to push up, okay? And then if you raise it again, I'm going to try to push down, okay? And then I'm going to try to push up. He's resisting that. That's great. All right, so now I'm going to do his, assess his feet. So if you kind of pull them up towards your face, and then push down on my hands, great. So he's strong there. The next portion of this exam is the musculoskeletal. We'll move on to that. And I'm going to have you, I'm going to go ahead and assess the joints of the musculoskeletal of the lower extremities while he's still laying down. So I would just palpate, and I would have, I could palpate the upper extremities, the joints. I would want to do that as well. Before I start, just ask for any pain as I'm doing it. I'm going to feel for any edema, anything like that. You want to kind of palpate the toes, the joints in the toes. Okay, so now I'm going to have you go ahead and stand back up, and I'm going to have you perform the deep knee bend. So this is basically just a deep squat that he's going to perform for us. All right, and then just come back up. So that's the deep knee bend. Next, we're going to assess the spine. We want to be assessing for scoliosis or kyphosis, any abnormalities in the spine that are outside of the line that the spine usually follows. So I'm going to have you, to assess the range of motion of the spine, part of it is to have him bend over and touch his toes. So I'm going to have him do that. And as he does that, I'm assessing his hip joints to make sure that they look parallel, that he's not tilted, and I can even kind of look from the front here, and he is parallel, so that's good. And his spine has a good curvature. And then I'll have you stand back up. And also, when we're assessing the spine, we're assessing for the S shape in the spine. So you can tilt this that way just a little bit, and you can see that he's got the good S shape. So tilt back this way. Let's see. The rest of the spine, we also want to check that by twisting. So I'm going to have you twist, kind of keep your arms down just a little bit, and then twist side to side. And then raise your shoulders up just a little bit and twist just a little bit deeper as you do that. So he's demonstrating good range of motion in his spine. Next, we want to assess his gait. So I'm going to have you just walk that way just a tad bit, a few steps, 5 to 6 steps, and then back this way, 5 to 6 steps. And that's perfect. He doesn't have any signs of a irregular gait. And we're assessing for, and the last part of the observation of the musculoskeletal that we want to assess is the Romberg test. So I'm going to have you raise your arms out, close your eyes, and then I want to be just a little bit where I can see that he's not wavering any, that he doesn't look like he's going to fall over. And he does not, so that's the result that we want to have. You can put your arms back down now, thank you. Next, we're going to do the neurological portion of the exam. So I'm going to have you lay back down, the neurological starts with a Babinski. I'm going to start with that. So I'm going to use an object. I have a marker that I'm going to use. I could use anything that's not really sharp, but that has a little bit of hardness to it. So I'm just going to bring my marker up with a little bit of pressure on the outer edge of his foot. And as I do this on each side, I'm looking to make sure that his toes don't actually go upward. His foot jerked just a little bit, which that's normal. I just want to make sure that his toes aren't actually going upward as they do it. The downward is what we are looking for. That's the normal sign. Next we're going to do the, the finger to nose coordination. So before we do that, let's do the heel to shin. So I'm going to have you take this heel and just kind of run it up and down this shin. And you're just looking for coordinated movements there that are smooth and rhythmic. And then now you can do the other side. All right, perfect. Now I'm going to ask if he could stand up again, or sit up again for me. And we're going to do the rapid alternating movements. And that is where I have him take his hands, tap his thighs, then he'll bring his hands up, flip his hands, and do this. And he does it slow a couple times, and then he'll speed up and get faster. Okay, that's good. Okay, so the next portion of this, we are going to do the finger to nose test. So I'm going to have you stretch your hands out, and then close your eyes, and then touch your finger to your nose on each side. Let's see. The next one we want to do the position sense of the finger. So I'm going to just have you, I'm going to take your hand and kind of hold your hand out for me. I'm going to have you close your eyes, and I'm going to take my finger and either pull one of his fingers down, or push it upward, and he's going to tell me whether or not it's going up or down.
Down, up, down.
All right, so we'll do this side.
Up, down, down, up.
Okay, great. All right, so now we're going to move on to the sensation portion of the exam. And what I'm going to do, I have a Q-tip, or just anything that has a dull side and then more of a pointy side. I'm going to have him close his eyes, and I would want to make sure that I do this on each side. I'm just going to do it on one side for purposes of videotaping, so I'm still in the video. But I would want to do both sides of the face, then both sides of the arms, and I want to do one side and then the other side, and then compare the two, and then the face, then the arms, then the legs, and then the feet. So I'm going to go ahead and demonstrate that. So just keep your eyes closed for me and tell me whether you feel dull or sharp.
Dull. Sharp.
Okay, great. I'm going to go to your hand now.
Dull. Sharp. Dull. Sharp. Sharp.
I'm going to your feet.
Dull. Dull. Sharp.
Dull.
Dull.
Sometimes it's a little bit hard to tell. I think if I had a pointer or object, it would help. So I would have assessed both sides and compared them. I'm looking for that they're equal on both sides. So the last portion of this, we're going to do the neural part is the deep tendon reflexes. I don't actually have the tool to do this specifically with, but I'm still going to go ahead and demonstrate it. I'm going to use my marker. What I would actually have, it would be a tool sort of like this, but I would have a triangular kind of a rubber, sort of a mallet almost, but it's not quite that, on the end. And what you do is you tap the tendon, and it creates a reflex just to jerk, and that's what I'm looking for. So I'm just going to start by assessing the brachioradialis, and we're going to, since I don't actually have the right tool, he's going to pretend when I tap him that he was having the reflex that he should have. So the brachioradialis is just a couple centimeters up on the arm, and then the thumb will jerk. That's the correct reflex. The next one is the patellar reflex, and the patellar reflex, I need him actually standing, not standing, but either on a table where his leg is off the ground or in a chair. So I would want to tap the patella, and then the leg would jerk out, and depending on how hard you tap it, you get varying levels of movement. So the last one is our Achilles tendon reflex, and so I'm going to just tap the back of the Achilles, and the foot will jerk up. And that is the correct reflex that I'm looking for there. So this concludes the musculoskeletal and the neurological exam. Thank you.